All right, I see I am up. Thanks very much for joining us today on our media briefing. We
Well,
have
I
a lot to
can't take it.
cover
I'm on
and
a
we have guests with limited time.
Zoom,
So we're going to
babe.
go ahead and get started. If you've got noise in the background, go ahead and mute yourself while you're not talking. And so we're going to start with Gary Millay from our Office of Emergency Services, and he is going to give us a rundown, a brief overview of Housing for the Harvest, the program which is now available in Monterey County. Hi, Gary.
Yeah, good morning, May. I hope you can hear me.
I sure can.
Okay, great. Yeah, everybody, Homes for the Harvest is a program the state started, very much modeled after what Monterey County was doing in the incipient stages of Project Roomkey for our agricultural workers. Homes for the Harvest isolates the program to strictly be just for people that work in the agricultural industry. And so what we've been talking about for the last 8 months with Project Roomkey, it's pretty much the exact same thing that we're doing for Homes for the Harvest. We're taking medical referrals from people that either have COVID positive or are suspected of having it or have been exposed to it and are having symptoms. And if they have no way to isolate themselves because they live in a congregate setting or are homeless, for example, then we will actually provide them a hotel room so they can be isolated for the 14 days of quarantine period. That is all done through the monitor and case management of the health department. And so the EOC through our care and shelter branch is the one that will run this Homes for the Harvest in addition to the Project Roomkey. The difference is the two projects will be separated out for the reimbursement coming from a different pot of money from the state. So the only key difference that is a requirement of Homes for Harvest that was not a requirement in Project Roomkey, even though we were initially doing that because we had those resources available, was medical oversight. With Project Roomkey, medical oversight is not mandatory. For the high-risk population, it's advisable because you don't want somebody to die on your hands because you didn't know that they were more sick than you thought. But for Homes for Harvest, it is a requirement to have medical oversight, which we now have as a county. We've contracted out with Maximum Healthcare, and so that has already been in place and started. If there's any questions, I'll be able to answer those. Otherwise, you can refer those to Maya.
All right, thank you. And then Gary has to get off the line very shortly. So as I mentioned to everyone, we're going to take questions about the Housing for the Harvest program right now. So I'm going to go ahead and look on chat and see if there are any questions. So I've got one for you, Gary. How many farm workers have been placed in hotels up till now, if you know?
You know, I didn't prepare an accumulated number. It kind of runs in spurts, just like with all of the guests in Project Roomkey. Sometimes we get referrals for a dozen in 1 week, and sometimes we get just a couple. But I will say that the agricultural industry is holding firm with about 30% of our people that need to be isolated. 30% of them come from the agricultural industry. I do apologize to everybody for not having to stay on the call, but as you're all probably aware, we have a power safety shutdown coming in, and I have to be on that call right now. So,
all right, thank you very much, Gary. And if I have any other questions, we'll work on them together.
Thank you.
All right, thanks. And now we're joined by Chris Donnelly from the Workforce Development Program, and he's going to talk about the Small Business Relief Program, which came up at our Board of Supervisors meeting yesterday and was approved, so we've got a new program to launch. Hi, Chris.
Hi, good afternoon, everybody. Just to let you know, yes, as Maya said, that we had the County Board of Supervisors approve our small business relief grant. It's a total of $468,000 that we'll be distributing out to small businesses in Monterey County. And we are working on some of the criteria and having fact sheets, and just give you an update that the grants will be up for $10,000 per business. The business needs to be located in Monterey County, corporate offices as well. There was a priority looking, part of the discussion was if there was going to be any priorities for those who've already existed receiving PPE grants or other grants that the County Board of Supervisors said no, but what we'd like to give as a priority to those who have not received any additional funding in the past. The unincorporated areas will be targeted first. That way they would like to see that funding go out to the unincorporated areas, and then looking at the rest of Monterey County. Also, there were some discussions about the type of industries first, and really the concern was the restaurant, hospitality, and the wine industries were areas to target it, but we'll be looking at all industries in Monterey County that they could be able to apply for the grants. We're looking at the week of the 19th to start with our community outreach to businesses, other other CVOs, the chambers, to be able to get the word out. We'll be having our informational webinars. Pardon me?
Go ahead.
So we'll be looking at the week of October 26th of having webinars on the 27th, 28th, and 29th. That'll be part of our fact sheets. That'll be able to provide update and information on the grant requirements, what will be required to be able to submit. The grant does allow businesses to charge back to March 18th, the start of COVID. So you'll be able to receive funding back to that point in time. It is a cost reimbursement grant. So if you're selected, you'll have to be able to expend the funds and then submit the receipts to us for processing. So that's just really some of the basic information area right now. We're working on our FAQs, our outreach and flyers that will be going out. We're going to be updating our website. It will be a web-based application where people will need to apply for the grant, and that'll be on our Workforce Development Board website. And we'll have that information out as well in the next week on how to apply and the dates. The start dates for the applying for the grants will be on November 2nd. We're looking at a 2-week period for grant applications. If we need to go a third week, we'll go to the week of the 16th of November. The 14th of December will be the last week to submit reimbursements for the grant, and then we'll be providing the County Board of Supervisors on December 28th, our program closeout and final reports. So any questions we have right now? So this is just the starting phase that we're going through. We're getting all of our information. Again, we'll have information out next week through our releases, information through webinars, and also on our website as well.
Thanks very much, Chris. And I know your time is limited. So if there are any questions for Chris about the Small Business Relief Program, this would be the time to ask them. I'm not seeing any in chat. Does anyone have any questions that they just like to ask before Chris is gone? All right, hearing none, seeing none. Thanks very much, Chris, for joining us for that overview. I sure appreciate it.
And we will have information out on our website on Monday on the grant period, other information, FAQs, and the flyers. So
all right,
if
so
there's any questions, then you can talk to us afterwards.
All right, thank you very much.
Okay.
Thank you.
Okay, bye.
And now I'm hoping that we still have Dr. Moreno on the line. We've got him for a short period of time to give us an update on county COVID news. And so I'm hoping that he's still with us because his time was limited. There we go. I do see him. Well, I see a screen.
Yeah.
Hi, good afternoon.
Hi. All right. Yes, Ed Moreno, Health Officer, Director of Public Health, Monterey County. So good afternoon, and just some updates on situation with COVID. We have received state approval on resuming in-person instruction for children through 6th grade at some private elementary schools and a couple of public schools. And these schools, or the principals and superintendents, will resume instruction when they have secured the resources that they need to implement their plans and when they have believe that they satisfactorily trained their staff on implementing the plans to bring the kids back into the classroom while maintaining a proper distance, using face coverings, frequent hand washing, sanitizing if they can't wash their hands, and keeping kids in cohorts throughout the day, not just in the classroom, but during physical activities and during meals. So they will decide on what date is most appropriate for them to reopen. And it may also be a matter of convenience if they're planning on reopening after some holidays. So that's the update for the schools. As far as guidance from the state, there is new guidance that was recently released, and this is from the California Department of Public Health, and it's for private gatherings. And there was previously some guidance issued initially in March from the state, and then it was updated in September, and this replaces those two guidance documents. So the state has provided this guidance for all counties, and they include 7 key points, but the full guidance is on the website. You can read it for yourself and get familiar with more of the details. But essentially, the first issue is the size of the gatherings, and the state has limited it to 3 households, and that, but with the point that they want to make is that the fewer the people, the better. Also, where that's answered by the guidance, and that is these are outdoor gatherings, and the state recognizes that there certainly would be benefit of having some shade at outdoor gatherings. So shade structures like tents or canopies are okay as long as the sides are pulled up. But they do not want the public to utilize this guidance as a means of organizing mass gatherings. So you might imagine, for example, a group of 3 households contacting another group of 3 households that contacts another group of 3 households, so on and so on. And before you've got dozens of households all meeting at the same place. They would consider that a large gathering. So that's definitely not encouraged. So these are small group gatherings. In addition, the recommendation is to stay home if you're sick, and if you've developed symptoms, recommendation is to notify, and that's if you get sick within 48 hours of having been at one of these events, that person should notify the participants of the private gathering. And that's because we believe that people who develop symptoms from COVID-19 are infectious for the 2 days prior to the onset of their symptoms. All right. In addition, there's still a recommendation that households maintain 6-foot distance between each other, and that individuals from different households should not share items. The use of face coverings should still be followed per state guidance. And then there's the issue of, well, how long can folks meet under this state guidance? And the recommendation again is less than 2 hours. Keeping in mind that the longer groups, people from different households come together, the risk of transmission increases. So actually, the less time, the better. And then the last thing I'll just mention that I want to point out from the guidance is that singing is not encouraged. But if people do sing, they should wear a mask. Again, it's because of the concern about increased aerosolization of the virus with singing or chanting, and that musical instruments are allowed, but no wind instruments. And again, that's because the concern of wind instruments generating aerosols that can transmit virus. Follow up on the blueprint and specifically the tiered framework. This is a graph that depicts the weekly case rates for Monterey County over time. The state released yesterday the most recent case rate for Monterey County, and it's you can see it's 8.5. It's the plot furthest to the right on this graph, 8.5, and that is a reduction over the the last 2-3 weeks. It's a slight reduction, but it is still a reduction. And so because it's 8.5 is less than 14, we continue to consider waivers for schools to bring kids back in the classroom. However, it's still above 7, which is the threshold that must be met, one of the thresholds that should be met to move on to tier 2, which has lower restrictions for businesses. And then this is the test positivity rate for the county. It's the black line, and the most recent test positivity rate has dropped down to 4.7 for Monterey County as a whole, which is not only less than tier 2, but it's also less than the tier 3 threshold. And then the gray line is the new line. We only have 3 data points there because it was just implemented by the state. And this is the equity metric. This is the average positivity rate for the census tracts that fall into the lowest quartile in the Healthy Places Index. Healthy Places Index is not a state of California index. It's been created by a group of Southern California counties for the purposes of assisting public health and healthcare professionals and policy and decision makers on understanding how different communities are impacted by a variety of variables, how their health is impacted by a variety of variables such as level of poverty, access to healthcare, salaries. This is what the state just recently introduced, and the index for this equity metric is now 7.4, or excuse me, the rate is 7.4. It is below the tier 2 positivity threshold. So in order for the county to move into tier 2, there's 2 paths that we could take. One is to get this 8.5 case rate down below tier 2 into the tier 2 level, so less than 7, and keep our metric index below 8 and our countywide metric below 8. And we did that for 2. If we did that for 2 weeks, state would consider moving us into tier 2. The other way of doing it is regardless of where we sit with our case rate, the state would also consider allowing us to move to tier 2 if both the metric index, the case positivity rate, and the countywide positivity rate were both in tier 3. So that's another path to moving into tier 2. And one question we hear a lot is, what's it going to take? What do we have to do? And I think we need to continue to do many things that we're already doing, which is to reduce the spread or transmission of the virus. And so again, keeping distance from people from other households, covering our face when we're outside, washing our hands frequently, follow the state guidance, which includes a lot of these recommendations in detail and specific for different businesses and for schools. Also, we should all continue to stay home if we're not feeling well, or if we've been in contact with someone who's ill, consider staying home and getting tested. And if people test positive, they should isolate and quarantine. And the county continues to provide alternative housing and support services to people who can't isolate adequately at home. Who should get tested? We know that testing identifies individuals who may be spreading COVID-19. And we recommend testing for people who are symptomatic, or been in close contact with someone who is symptomatic. Healthcare workers and first responders many of them continue to have periodic testing to determine whether or not they are asymptomatic carriers and spreaders of COVID-19, so they can be removed from the workforce, so we can avoid outbreaks among our healthcare workers and outbreaks among our first responders. Anyone who's taking care of individuals who's at high risk for complications of COVID, certainly be tested. And individuals who have frequent interaction with the public, we still refer to them as essential workers, but most importantly, it's the essential workers who are frontline workers, meaning they're having regular encounters with customers, and those individuals are at higher risk and should be tested, And then finally, anyone who's concerned that they might be an asymptomatic carrier, so they don't have any symptoms, but they want they're concerned and they don't want us, they want to know if they're positive, infectious, potential infectious, and so that they could isolate themselves and not spread it to other family members or household members or people at work. They too can get tested. We do have additional state-supported drive-through testing, as you know, Maya. Last week in the cities of Castroville, Gonzales, Soledad, and King City, the group that is supported by the National Guard tested 560 individuals, or excuse me, collected specimens from 516 individuals. And as of yesterday, 326 tests were completed, and there were 17 positive individuals. And we're the other tests are being performed as well. These are free, open to individuals 18 or older, and it's a first come, first served basis. And this week we continue to have some of these testing opportunities in Monterey County, and we'll be testing through Friday of this week. It's again free and open to individuals 18 and older, and first come, first served. And then we continue to have the ongoing OptumServe testing, and that we did get state support to move our Greenfield the testing operations from Greenfield to Seaside High School. They'll be starting this coming Tuesday. And fortunately, a lot of the, many of the healthcare providers in South County are now testing in their clinics. And so our testing rates have gone up in those South County clinics, and we're able to move this site over to closer to the peninsula so that people who live in the peninsula will have greater access to free testing. Again, appointments are, and the Cesar Chavez location is unchanged. And I just want to point out the public can go to the website that I've got here, mtyhd.org/COVID testing, and they can find the testing sites that are, and clinics that are available to them. And then I want to end with just a reminder that we're in flu season, and we're entering flu season during a pandemic. So we'll have 2 different viral strains circulating that cause similar symptoms. And so it's really important this year that folks get a flu shot. There are some individuals that are still struggling with their recovery from COVID-19, and I'm concerned that these individuals may be more susceptible to complications of influenza should they get infected. So not only could a flu vaccine protect someone who's struggling with their recovery from COVID from developing complications of getting sick from flu and developing complications, it can protect people, other people who from getting the flu who might pass the flu virus to a COVID survivor. People who've had COVID should get vaccinated. People who don't think they've had COVID should also get vaccinated for with a flu vaccine. Flu vaccine has also been shown to reduce emergency room visits and hospitalizations due to flu, which during a pandemic is important because that will free up hospital beds for others in Monterey County. And the public can go to our website, mtyhd.org/flu, to look at our clinic schedule and our own county supported flu clinic schedule. We started vaccinating at our clinics on October 10th, and we will be vaccinating. The last clinic is November 2nd. So that's my update.
Thank you. And I know that your time is limited. Are you able to take 1 or 2 questions
Sure.
before
Yes.
you have to get off the call? Okay.
Yes.
And so listen, this is a long question, so I'll pace myself with it. Epidemiologists at Stanford, Harvard, and Oxford universities penned a document last week claiming that current COVID-19 lockdown restrictions are causing numerous devastating short and long-term public health problems, and that keeping the restrictions in place until a vaccine is available will cause irreparable damage and disproportionately harm the underprivileged. Do you acknowledge, like these others do, that COVID-19 lockdowns are resulting in lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, declining mental health, and other health problems, especially among lower income people?
All right, so thank you for the question. There's a lot in that question. So what I can say is I haven't read the article, and maybe the person who's the reporter who's asking can send a link to that the article. I'll look into it. So I really can't comment on the recommendations from that group, but I can say that during a pandemic such as COVID-19, where no one has immunity to it, there's going to be vast impacts from the virus itself and from the threat of spread of virus in the community, as well as the mitigation factors that are put in place, such as restrictions on movement and requirements for isolation and quarantine to slow the spread of the virus. So it's a broad effect from a variety of factors. I'll acknowledge that, but yeah, if the reporter could send a link to you, Maya, and you can share it with me, I'll look into it. Thank you.
All right, will do. And then another question. A World Health Organization official said recently, prolonged economic lockdowns are not recommended to fight COVID-19. Would you agree with that? And if so, would you, or in the question includes any other county official, consider the impact of the local and statewide shutdown? How would that impact the local approach?
Yeah, so thanks for that question as well. So again, if the reporter could send that to you, May, and share it with me, I can look into that. What I can say is that as a reminder, the county, Monterey County is still aligned with California Department of Public Health in moving through the reopening the economy, and as the state issues guidance and the state moves counties into less restrictive tiers, and hopefully we will be there soon. I'd like to move along with the county, with the state, and try as much as possible to adhere to the guidance. So I don't have a specific answer to the question, but that's just a reminder. We're doing what we can to release some of the restrictions, and I'm still, as long as the epidemiology is supportive, I'll do my best to not be more restrictive than the governor or the state health officer when it comes to restrictions on businesses and schools.
All right, and then I've just got one, I'm gonna get one last question in if I could. Is there something more being done besides educational outreach to attempt to lower the equity metric and target those areas disproportionately impacted by COVID-19? How could those numbers be lowered? They appear stagnant based on the 3 chart dots that you showed.
Right, so thank you. So the efforts, there are ongoing efforts that we've been doing here in Monterey County, and we do want to continue to explore with the state and local partners additional strategies that might be able to further bring down the rates by reducing transmission of the virus. So besides the outreach, as a reminder, there's the testing, working with the state to increase access to testing and decrease the turnaround time in testing. So the locals working with the state and with private sector through contracts, we have been able to increase testing access through most of Monterey County, but in particular really increased testing access in South County, and much of that places like Clínica de Salud, the Soledad Health Clinics, Memorial Hospital have all stepped up and increased their testing capacity. And the laboratories, the public laboratories that are approved by the state of California to do testing on specimens collected in Monterey County have decreased their turnaround time. So I think part of that is also contributing to trying to bring down the positivity rate in the census tracts that are represented by the equity index, Maya. The important thing is that I want to point out is that just testing isn't going to bring down the positivity rate. We really need to follow that up with isolation and quarantine. And so the county we were one of the first first counties to not only implement alternative housing for people who can't isolate for themselves, but the ag sector, and working with the ag commissioner and the county, other county departments, one of the first to implement alternative housing for ag workers, many of whom are live in South in those census tracts that are represented in the Health Equity Index. And so those are just a few examples of things that we've been doing and continue to do, and hopefully we'll be able to advocate at the state and federal level to continue to receive resources that will allow us to continue to provide those services to people living in the census tracts that are represented in that the lower quartile. And with regards to the three positivity rates that were reported by the state, yeah, we have 3, and it looks like it's I think the term that was used here was stagnant. It looks like the rates over the 3 reporting periods has been level, but if we look at the positivity rates and the case rates for the last, I think, 8 reporting periods that we have, the overall trend is down. So I suspect that the positivity rate for that lower quartile, if we were measuring it 2 months ago, would have been much higher, just like the positivity rate for the county overall and the case rate for the county overall were higher. So everything has been trending downward. The majority of counties are also experiencing a progression downward in their case rates and positivity rates. So we really need to continue to implement these strategies and try to make improvements, like we've made improvements in access to testing, made improvements in turnaround time, made improvements in support services to people who are in isolation. We'll continue to make improvements on these variety of these strategies, and we'll continue to work with the California Department of Public Health and California Department of Food and Ag and California Department of Social Services to find ways that we can work with them to bring in additional state resources to further enhance our transmission reduction strategies.
Thank you, Dr. Moreno. And I've got to ask, have we hit your time limit?
Yes, I have to be, yes.
All right,
Yes.
There is one more question in chat, but I'll go ahead and forward it to you. Sorry, we only had it for a short time. So thanks very much for joining us, Dr. Moreno.
Yep, glad I could be here, Maya.
And then Dr. Moreno covered some of the information on the testing sites, but we did have Karen Smith on the line to elaborate. Karen, is there anything you'd like to add to the information that Dr. Moreno put out about testing?
So just knowing that on Friday, or not Friday, on Saturday, Greenfield will close an hour early, so it'll close at 7. And then the question about the speed bump, the reason that the Greenfield side is being moved is because the state requires us to have an 85% usage rate based on their capacity. And for the past several months, the the use of the Greenfield site has gone way down. In fact, the last report I got, which was this morning, showed that last week's was at 25%. And yet, when you look at the amount of testing that's being done in South County, we're making the mark. So that's really why it's being moved, is because, well, 2 reasons. One, and the underutilization, and then Seaside is an area that has been underserved, that the Seaside general area. And that's it.
All right, and thank you. Thanks for adding that information about the testing sites. So now we're going to pivot from COVID to our fire recovery information. And thanks for those who've stayed on the line with us to start on this topic. Rusty Harris-Bishop is going to join us from the EPA to give us an update on the work that is going on in the fire areas. Hi, Rusty.
Hi, good afternoon, May and everyone. Thanks for inviting EPA back. So we have really just been on the ground for about 5 days in Monterey County. doing our phase 1 cleanup work, which is the collection of household hazardous waste in burned or damaged structures. So we've been working in the area of the Carmel fire since I think we've had field crews that were doing the actual collection of materials since last Friday. And I just want to draw your attention to remind you that we have a website at www.epa.gov/2020 CA fire response. And I can type it into the chat as well. But we added progress metrics that went live, I believe, today or yesterday. And so it looks like right now we are at 35% complete in Monterey County. So we've been making great progress. This is only, I believe, for the for the River and Carmel fires. I don't believe we have an estimate for the number of structures in the Dolan fire. So that will definitely increase our numbers that we have left to do. But currently we are almost 35%, and about 5% of those properties that are to be assessed are going to have to be something else done. Either they have a remnant structure that poses a danger to our crews, or there's a precarious tree that could be pose a threat. And so we've made note of that on the map. If the resident goes to look up their property address, it should be colored orange or orangish. I'm colorblind, so people tell me it's orange and I'll believe them. And that means that there's either a structure that we weren't able to get into because of too dangerous, or other reasons why we couldn't access it. Could be like a roof had fallen in and we don't have the equipment to lift it up to get underneath it. The phase 1 work is typically done by hand, and we had some media out on Monday to observe our crew out off of Tasahara Road, and they could see that it's a very physical effort. Phase 2 is more that heavy equipment with bulldozers and excavators that will take care of those heavier items, and they will be notified if there's household hazardous waste potentially left on site that they will take care of in phase 2.
All right, thank you.
I just wanted to introduce, I think she's only available on the phone, but my replacement for the next couple of weeks will be Catherine Jenkins. So I will make sure, Maya, that you're in touch with her, and we'll continue to provide updates as long as y'all let us.
Thank you.
Yes.
And thanks
Hi,
for
I'm not
being with
sure.
us. Go ahead.
Hi, everyone. Can you hear me? This is Catherine.
Yes.
Hi. Yeah, like Rusty said, I am looking forward to working with you and providing you with the same types of updates. So if there's anything else that you need during this process, please feel free to reach out to me and we can work together.
Thank you. It's very nice to meet you, and Rusty will miss you.
And I'm sure I'll be back.
All right. Thank you. And now we're going to turn to Kevin Wynn from the Small Business Administration, who's going to share with us some disaster application and information updates. Hi, Kevin.
Hey, Maya, good afternoon to you as well. One of the first things we want to share is that FEMA has extended the deadline to register. So folks have until November the 23rd, 2020 to register for any kind of FEMA or SBA assistance. That's great news. They've got an extra month in which to get their recovery process going. SBA has approved thus far to date 197 loans for $21.5 million. 179 of those loans may have been for homes and renters for $19.9 million, and 18 of the loans have been for businesses for $1.6 million. SBA continues to work hand in hand with our FEMA counterparts in getting the word out. Like I mentioned about that deadline extension, it's great news, so we can get that word out to the entire community and help them to apply. Register with FEMA at disasterassistance.gov. Come on over to SBA and we can assist you there in getting the rebuilding and recovering from this disaster going. Any questions? 659-2955. And I'll be more than happy to stay on the line, Mayo, for additional questions in disaster recovery.
Great, thank you. Great news on that. And now we're going to go from the fire to my other section today of interesting topics. And I'm very pleased to have Kate McKenna from LAFCO joining us today. Towards the end of the board meeting yesterday, she and I guess I could say a colleague, gave a very interesting report on fire protection in unincorporated Monterey County. And the report is really worth another look and a listen about the impacts. Thanks very much, Kate, for joining us.
You're welcome. Thanks for having me today. Yes, I'm Kate McKenna, Executive Officer with LAFCO, Local Agency Formation Commission of Monterey County. And the report that was presented yesterday was really part of a follow-up action to a presentation given in July by the county staff to the Board of Supervisors pertaining to defensible space and wildfire disaster issues. At that time, the Local Agency Formation Commission had just completed and adopted a study of fire protection and emergency medical services in the unincorporated areas of our county. And so the county staff thought it would be a good idea for the Board of Supervisors to hear that information. So the study itself, for anyone interested, and the slides that we presented yesterday are available on the homepage of LAFCO of Monterey County's website. So, so you're all welcome to check there. In terms of a little bit of background about the study, LAFCO is responsible for regulating the boundaries and services of cities and independent special districts in Monterey County. And as part of that responsibility, we do routine studies of our local governments. This particular one focused on agencies that are local agencies that are providing fire protection and emergency medical services. And that we studied 12 independent special districts, 2 volunteer fire companies, and a county-wide service agency called the County Emergency Medical Services Agency. In addition, we studied the supportive role played by the county's Emergency Communications Department. The county itself, consistent with state law, there is no mandate in California for county governments to provide fire protection. Our county here in Monterey does not directly provide fire protection services, but the county does have direct roles in countywide ambulance contract services, emergency dispatch, regulating land use and development in the unincorporated area. And the county also has a very cooperative role in promoting defensible space and fuel reduction. So our study presents some key findings, primarily about the day-to-day operations of our local governments that provide the fire protection and EMS services. What we found is that we interviewed all of these agencies, and they report that all of them believe that they are able to sustain their services for at least the next 5 years. We did find that due to budget constraints that some of those services are expected to be modified and reduced over the short term. There are some very significant revenue limitations, primarily with respect to property taxes that have not kept up with costs. There are also some very stark variations in revenues that are available to our local fire service agencies. For instance, the per capita revenue ranges from about $100 to over $3,000. So with that variation comes some unequal service levels throughout the county in different regions of our county. In the past, LAFCO has been effective in using our traditional tools of annexations and consolidations to address where there are fire protection issues. But we find now that there are limited opportunities for us to use those tools without added funding. So the local fire protection districts at this time are not currently seeking any LAFCO action for annexations or consolidations. We're also finding that, of course, wildfires have impacted our local communities and have affected fire insurance and the needs for vegetation management. We are finding that we have two volunteer fire brigades on the Big Sur coast, and the demographics for recruiting those firefighters have changed. Also, the tourism impacts to the Big Sur coast and other districts have really affected the sustainability of those operations. We reviewed some issues with the 911 call center and found that they're coping with some very severe staff shortages and increasing equipment costs. Having presented those key findings, we developed with our local partners some ideas for consideration in the future. And it's our hope that these ideas can be considered in a collaborative manner and that will help our county to move forward to sustain and improve fire protection and emergency medical services. The ideas that were presented yesterday for consideration are divided into 4 basic categories. Some have to do with state legislative actions, primarily funding related. Some of the ideas are for potential considerations are county level or county-wide options. There are also ideas that we laid out for our local fire service agencies. We presented ideas for communications, the county communications system, and some thoughts about the Big Sur and Mid-Coast areas in terms of collaborative efforts there. Having heard this informational presentation yesterday, the outcome of the meeting is that the Monterey County Board of Supervisors adopted a measure to establish an ad hoc advisory committee consisting of Supervisors Phillips and Adams. And the purpose of that committee is to consider some of the issues identified in this study, to discuss the issues with stakeholders and county staff and other partners, and see what can be done in the short and medium term future. So our LAFCO staff is available to assist and facilitate anywhere that we can, and so that's the upshot from the meeting yesterday. So thank you.
Thank you for giving us kind of a brief overview of what was really a very extensive report yesterday. And if you could stay on just a little bit longer and see if we have some questions for you. I've got one more presenter I'm going to sneak in. We've got Carl Holm, the director of a resource management agency, who's going to tell us about a community meeting coming up about the Carmel Lagoon, and we'll also cover some updates on some projects related to that.
Yes, thank you. Good afternoon. Carl Holm with the Resource Management Agency. And each year about this time, we start our collaboration with the
the permitting regulatory agencies about how we're going to manage the Carmel Lagoon in this upcoming winter season. This year, we're also obviously taking into account the fact that, you know, there was some burn in the area of the Carmel River watershed, and how that may affect when the water comes down that system. So we're having a community meeting. The idea is that we will explain what the program entails. Includes sandbagging along the northern edge of the lagoon, when we intend to do that, how we intend to do that, as well as managing the sandbar, which we've been doing on a regular basis since about 2010. So about 10 years now. We've learned a lot as we've been going through that. And so the manner and how we do that sandbar management has evolved working with the regulatory agencies. So it's become pretty standard, but at the same time, we want to have that community meeting, make sure the community is aware that, you know, even though there are still, you know, there's still some fire burning on the Dolan fire, and we've had these fires, we're turning to the winter and what might be coming with the winter rains. Hopefully we will get some winter rains, but you know, how we manage that along with the response to the burn areas. We're also moving forward with the projects along the Carmel Lagoon. We're looking at a long-term type of project that could potentially armor along Scenic Road to where we wouldn't have to go in and do this management type of work all the time. It would be more on a as needed emergency basis only. And we've been working on technical studies to develop a draft environmental impact report that we will get out. We've been working with the agencies on what the information is that they need to see in that EIR, as well as the EIS for the NEPA part of that. We also have been working on the Carmel River floodplain restoration project, CR3. It's the causeway of Highway 1, where we would connect the south arm of the Carmel River under Highway 1 and into the Carmel Lagoon. So we have all these projects that we're working on, and the intent Monday at 5:30, we'll be having a community meeting to give an update on all these projects, including what we're doing with the flood management in preparation for this year's winter storms. So.
Great, thank you, Carl, and thanks for staying on the call
Sure.
for so long and waiting through all the other topics.
Right.
So that's all the presenters that we have, and I know we're kind of getting close to 1 o'clock. I don't have any questions in chat for any of the the people who are remaining on the line. Are there any questions that people have that they'd like to ask for people who are still with us from EPA, Small Business Administration, LAFCO, or RMA? Not seeing any and not hearing any. That means you all get lunch. Thanks
Enjoy
very
your
much. Thanks for joining us on the media briefing today. Our next briefing is next week. We'll see you then. Bye-bye.
Thank you.
Man.
Oh.